perspectives, which also feed into, when we first started noticing tooth decay more and more, isn't there? Also during Neolithic period, or, we didn't notice it then. We know we've looked at archaeological evidence around when we started grain farming 10,000 years ago, but also, changes that happened with the Industrial Revolution. And also, some of the growth of some of the other movements as well too, such as other discoveries around bacteria as well too. Shall we can delve into that a little bit?
Absolutely.
As well too.
All right. Thank you for joining us today. Today we're here with Sarah Hancock, who is studying her PhD in public health nutrition, and we're going to dive into the foods that the issues and foods that are connecting to problems that we're seeing in the mouth, so tooth decay, to problems that we see in the body, so obesity and weight gain. So if you're suffering from these issues, then there's a range of recommendations out there that tell us that we should eat certain foods for certain conditions. But how does the evidence relate to this? And does it all stack up in terms of what we are giving our children and what we are perceiving as healthy foods? Sarah, thank you for joining me today.
Oh, thank you for inviting me on the show.
Sarah, we've just started our conversation. There's so much to talk about in this area, and I really enjoyed a paper that you recently published in the New Zealand Medical Association journal, wasn't it?
New Zealand Medical Journal.
Yeah.
Yes.
Look, there's the cross between dental caries and the foods that we know are causative for certain dental diseases and public health nutrition that now that you are studying is something that I've dived into, previously when I wrote my book, and I found there was a lot of disconnect. So I'd really like to kind of go back into this story and really find what you found looking through the evidence, and also to dive through some of the questions that people are wondering about what they see in guidelines and what they should feed their children themselves for better health. Tell us, as we start, how did you get into this area? What drove you into public health nutrition in terms of, as a profession?
Well, I've got a background in exercise physiology and sports psychology through my initial bachelor's degree, which I completed last century, and then did a master's in health technology assessment, which was essentially the analysis of evidence-based medical research and looking at how strong recommendations were, for drugs or procedures or also dietary interventions as well too. And about 10 years ago, my daughter was diagnosed with a non-celiac gluten sensitivity rather. And so we started delving into the whole gluten-free products and things like that. And they weren't terribly nice. They weren't particularly tasty, but they were full of sugar, and they're just not particularly good for you, and they're full of emulsifiers, and they're quite ultra-processed as far as some of these, like some of your substitutes for flour and other, grain-based products. And so we thought, well, this isn't very nice, and they don't seem particularly nourishing. And so we started going down the route of, trying to get processed food out of our diets. And then the low carbohydrate, healthy fat movement was gaining momentum with the work of Dr. Karenson and Professor Grant Schofield and Craig Roger with their book, which has become a bestseller, the What the Fat book. And so we read that and went, well, this makes complete sense. And my husband is a physiotherapist, and he started, we both did some self-experimenting with the lower carb, healthier fat way of eating. And we got rid of, or he discovered that there was some inflammatory issues that ceased. And then he started recommending that to patients who had concussion issues and also, long-term inflammatory conditions. And they experienced some resolution and lessening of symptoms. And we thought, well, there's something in that. And then a few things were happening at around 2016. And so I had the opportunity to investigate doing a PhD at AUT under the supervision of Dr. Karenson and Professor Grant Schofield. So I've been very, very lucky to have their expertise available to me, and that they've been really, really great in this field of research. And so, but we did identify that there was a gap, and we looked at what put children into hospital and where we were spending a lot of public health money, and the numbers of children who are admitted yearly into New Zealand hospitals for the removal of teeth. Well, the taxpayer here gets up every day, Stephen, to spend $132,000 per day the working week on the extraction of the teeth of preschoolers. And that's just, quite frankly, appalling. That comes to more than 32 million New Zealand dollars per year, and that's money that we could be spending elsewhere for what is a preventable disease, isn't it? So I started looking at that a little bit more and looked at okay, well, what is the evidence around the foods that are good for oral health, and found that actually full fat dairy is protective. And we also found that vitamin D and vitamin K2 rich products are protective in the mouth, or are associated with protection. But there's a paucity of evidence of intervention trials that have examined this. Interestingly, there was a trial in Switzerland where they looked at a Stone Age diet as part of a TV reality show. They put these people in the hills and they didn't give them any oral hygiene products at all. They just said, this is what you're eating. And it was what they described as a Stone Age diet. And they found that the periodontal health of these people improved as well too. It's a very small study, but you still think, well, that's good exploratory research. And then you look at all the things that are associated with harm. And so there's a well-established relationship between sugar as harmful in dental caries, and that's been established through Western Price's evidence of free-living populations where there was no or little refined flour or sugar. And then he saw how population dental health was worse in areas which were urbanised and had access to refined flour and sugar-based products in the 1930s. But we've also got the wartime data where populations where there was a scarcity of sugar were experienced less dental decay or less dental caries over time. And we know that in Iraq, during the more recent sanctions there of sugar and flour products, the kids' dental health improved as well too. So there's all that evidence, but we still thought, well, let's look at other fermentable carbohydrates. And we've just submitted a systematic review to a journal where we've found that there was an association between, when we looked at the studies, the definitions of starch and sugar-based products varied across those studies. But we found that the between meal intake of these products was associated with a higher risk of dental caries and higher caries counts, which is really interesting because a lot of those foods are advocated as healthy in current dietary guidelines.
Yeah, it's an interesting point, isn't it? And you kind of start to open up the can of worms where it's why are dietary recommendations separate from what we see in the mouth, and then what the public and society are experiencing. So the amount of money that we, and also the health burden that we're placing on our children who are going under general anesthetic to have rotten teeth extracted. That is quite alarming, and it's something we see in the dental practice. And obviously that I've talked about for a long time, but the dental industry has talked about for a long time. But I feel that what you're talking about here is somewhat of the the anecdote to why we've misunderstood this problem a bit. And the sugar and tooth decay link is absolutely stamped into public consciousness, that we know that there's a link there. So can you explain a little bit about some of the evidence that establishes that in terms of the amount per day, and just so people can start to get some of the what the scientific research has shown in terms of consumption and risk of decay, and then we'll start to kind of span out from there.
There's also a very long established dose response. The higher the amount of sugar that you have in your diet, the greater the risk of tooth decay, and that's also really well established. And that's also the exposure to foods, but it's the high frequency of these foods as well too. So when I was doing that systematic review, we found that it was difficult to tease out, the total starch and sugar-based food intake over the day, because if you're just looking at mealtime, breakfast, lunch, dinner, often these foods are consumed with foods that are protective, like your cereals will be consumed with, say, milk, which has a protective effect. But we know that the high frequency intake of sugar is implicated in not only dental caries, but also non-alcoholic fatty liver disease and obesity in children, And so that's where we've got these very clear associations between this very high frequency intake, which is a high total load of sugar in the diet. And so when you look at total starch intake, or, if you're looking at, say, vegetable starches such as potatoes, that sort of thing, you're not going to see those associations. And we're not trying to say that, okay, you eat more carrots, you're going to get tooth decay, because there's other health effects of, say, carrots as well too. But we're looking at these highly processed breads, these processed cereals, but also there was that evidence that, sugar was implicated in dental caries that was established back in the 1930s, but also that vitamin D and full-fat dairy was also protective in the mouth. Also established in the 1930s. But then we had the oral hygiene industry came along, where there was this idea that if you physically cleaned your teeth, we wouldn't have plaque buildup, and therefore your teeth would not decay. And so they've, back in the 1930s, and this is really well summarized in a review paper by Philippe Hujol, who's a professor of dentistry in Seattle. And what happened was the American Dental Association was coming under pressure from the oral hygiene industry, and they could do that by advertising for oral hygiene-based products in the journal. And there was a branch of the American Dental Association that sort of looked at this and went, okay, well, is there any evidence for these items being associated with therapeutic benefit, or is it a cosmetic thing? So where should these be sold? Should they be sold amongst the lipsticks or sold with the aspirins, that sort of thing? And so, of course, there's some pressure from the oral hygiene industry with a marvelous marketing campaign, of course. And then, of course, the sugar industry get on this as well too and say, it's okay, if you just clean your teeth, you can eat whatever you like. And so by 1945, the idea of just having your vitamin D rich foods, which are found in our meat and dairy, and which also, as you well know, you need vitamin K2 for the activation of vitamin D. Well, that idea was sidelined in favor as oral hygiene strategies being, associated with you could prevent poor oral health with oral hygiene. And so those dietary strategies got sidelined. And then that was running parallel to the research in general health, where heart attacks in American men, and in that post-war era, were being pinned to the increase in fat intake, or fat intake was associated with heart attacks, where the role of sugar in all this was neglected as well too, due to all sorts of things such as vested interests as well too, and a very powerful sugar industry, and some very strong personalities in that area. Yeah.
It's interesting, isn't it, to think back to when the cause of why we think about oral hygiene as a fundamental indicator for prevention of oral disease. And, because if you mentioned Neolithic studies, and obviously Weston Price demonstrated this as well, that there are the vast majority of human populations have not used oral hygiene practice significantly, and haven't seen any of the rates of decay that we see in modern populations. What have you seen in terms of studies that look at Neolithic populations, and in terms of the decay rates, but they measure calcified plaque on the teeth, and they look at some of the microbiology.
That is fascinating, and that's actually, we're really lucky that we can measure calcified plaque on teeth, because it does actually provide a lovely snapshot as to what the diet was like and what the conditions were for decay to develop, that sort of thing. Whereas, we can't study old gut samples, for instance, because, they've dissolved and decomposed. But, while we can still study the plaque, that's where those studies are hugely valuable in showing that the decrease in diversity of the oral plaque that was associated with the increase in farming and the establishment of agricultural practices in Neolithic era times. So that's really valuable research as far as, okay, well, we're looking at when our dietary patterns changed, when we stopped having to go and hunt for all our food, and that when we started eating grains and wheats and those types of food, as opposed to just hunting them all the time, that actually, the diversity of the biome went down. And of course, we had a greater proliferation of the bacteria that are associated with decay as well too.
So we've mentioned that, from the 30s onwards, we've kind of moved away from this idea of diet as the baseline for dental disease. I feel even in modern times, this has kind of stepped up. So in the last, 2 to 3 decades, there's been, a swathe of products and dietary shifts that have potentially accentuated a lot of the issues that we see in the mouth. And
Absolutely. Yeah.
and so we have this early, association in the literature between sugar and dental caries, but these people hadn't seen, kind of the amount of sweetened drinks and things like artificial sweeteners, and a lot of the ways that the food industry gets sugar into child's diets, but also right throughout the population. Have you seen any kind of what is the evidence showing this in terms of rates of tooth decay, and how has this affected our modern rates of decay?
Well, we had the implementation of community water fluoridation in New Zealand since the 50s and around the world since then. And so, of course, that has an effect on the severity of caries. But what we're also seeing now is that the differences between caries in fluoridated areas and non-fluoridated areas in New Zealand is getting lesser and lesser. Like our latest Ministry of Health data show that nationwide, there's very little difference in caries-free status between of kids in fluoridated areas and not. So that's interesting. We've had this public health measure designed to affect caries rates without changing behaviour. But since the dietary guidelines of the United States, which were closely followed by the implementation of similar guidelines around the world, we've had a steady increase in the invention of what we classify as ultra-processed foods. Like there's been 100,000 of these things invented just since 1990. And so there's a whole lot of foods that I don't think you can really call them foods. They're food products that have been, around, that have been increasingly invented through all sorts of processes. And so what we're seeing is after we saw initial drops in tooth decay at a population level, we're getting the rampant caries is going up in small children. We're getting more and more children who, like 40% of New Zealand's 5-year-olds are presenting with tooth decay at age 5. Which isn't great. And so, but we've got all these, so that's increasing, but we've also got disorders like non-alcoholic fatty liver disease, which is the liver's essentially silent scream that something is really going wrong as far as our diet's going. Well, that's gone up exponentially since since the early 1980s. Type 2 diabetes has gone up since the 1980s. But so with the dental caries is essentially, it's a bit of a canary in the coal mine as far as an early alarm bell for deep oral, but also metabolic health being far less than optimal. And actually the foods that we're eating are pathological in tooth decay. So to answer that question and to explore that topic a wee bit more, there's been all these hyper-palatable, ultra-packaged, ultra-processed foods, which are backed by health claims because of what they don't have. And that sort of goes back also to that research in the 50s where we focused on macronutrient intakes, where, if your food was high in fat, this was bad for you. So, boost up the carb content. And, so we've got these foods that are advocated for that come with health star ratings on the basis of lack of fat in it and whether it's got fiber or carbohydrate intake as well too, and protein. So we've got a system that is really quite a mess. It's influenced by vested interests, trade policy, particularly with agricultural production of staple crops as well too. Yeah.
It's an interesting story, isn't it? You kind of see that, that Western civilization knew that sugar was an issue with dental
Yeah.
caries quite early in the 1900s, and then
Yeah.
there were a number of kind of mitigating factors that softened the discussion a
Yeah.
little bit. It's like, well,
Yeah.
it causes tooth decay, but if we brush our teeth, or there's
Mm.
there was just a lot of distraction, wasn't there? And then this has kind of
It
trundled
was.
along.
Yeah. And I think it's really interesting because that must have been quite a conundrum for the dentists of the early 1980s who have been, sort of saying, well, cheese is good for your teeth and full fat dairy is good for your teeth. But then we've got these government endorsed dietary guidelines that state, well, actually, you can't be having that sort of stuff because it's going to clog you can't be having full fat products because it's going to clog your arteries. And so then they've sort of got, well, we know what's good for the mouth, but okay, we've got these dietary guidelines now. And so, there is the school of thought that that's partially responsible for the increased promotion of oral hygiene strategies, so that if you just get stuck into removing calcified plaque from teeth and brush your teeth every day. And maybe that's a reason why this has become the cornerstone of public health dentistry advice, is because we've got these dietary guidelines, but we've also got this oral hygiene strategy, but we can't now recommend full fat dairy, and we've got to now start advocating for, because the dietary guidelines say this, is these more carbohydrate products. But also our dietary guidelines state you should be, growing children should be having grain-based products up to 6 times a day as they get older and enter adolescence, which is the other disconnect that we were discussing as well too. But now we've got, over the last 3, 4, 5 years, is the increased influence of the vegetarian and vegan groups, which are promoting a plant-based diet, and with the omission of food groups that include meat and dairy and eggs. And that's another complicating factor, because a lot of the plant-based diets have as important components grain-based products and some ultra-processed foods that are implicated in poor oral health, but also nutrient deficiency as well too.
We're really not making this easy for ourselves, are we? We keep
No,
pushing impediments to eating good food, but
no, we're not. It just seems to be all these influences from big academia and big vegan and big industry and big ag and big pharma, and it all just sort of has this impact on on the food environment and food availability. And whereas you just sort of think, if we just go back to eating unprocessed foods, from your meat, your dairy, your seeds, nuts, vegetables in particular, we'd solve a whole lot of problems. But we've got a food environment now that's been influenced by big ag and big pharma and big government and big academia, and some of these ideological or groups which form beliefs based on ideology, especially with regard to meat and dairy consumption. And then we've got the environmental element as well too, and the idea that much of our environmental problems are due to cows and dairy, and that's to blame for that. But I see the other day you spoke to Diana Rogers, who is an expert on regenerative agriculture, which challenges those sorts of ideas as well too. So we've got we've got all sorts of influences on the food that we eat. And some of the data from my PhD research, when we showed, I did a qualitative study on, okay, what are the barriers to eating well? And a lot of it was other people, but at all levels, whether it was the children, whether it was health professionals, whether it was the parents, they all said the hypermarketing of the ultra processed food environment, whether it was the kids getting bombarded with chocolate fundraisers at school, and Lamington fundraisers at school and pie fundraisers at school, and big business sort of offering lunchtime foods. And then the parents are saying, but we're really busy and we have busy, hectic days, and you pick up these tired, hungry kids from after school sport or music or whatever, and everyone's busy, and it's 5 o'clock in the afternoon, you're at the supermarket hungry, and there's a ready meal there, and so finish up getting that. And then we've got, kids walk to school, they walk past a dairy, and there's these lunch packages there. that might be Oreos, Twisties, a little drink of fruit juice, and some pretzels, which also might have a health star rating on it, indicating that these are healthy because they don't have very much saturated fat in them. So it is a mess. And so there's all these ideas and influences on what we eat, which does affect the choices we make regarding our food.
I'd really like to dive, back into those guidelines again. But before
Yeah,
we do, I thought we'd cover one of the audience questions we received
yeah, sure.
before. And for those listening, if you have questions for the conversation or about food intake, just if you post them in the comments, we can cover them at the end of the discussion. But there was a question about xylitol and dental health, and it is a topic that comes up a little bit. What have you seen in terms of the scientific literature and xylitol?
Yeah, that's a really interesting question because, xylitol is associated with a reduction in Streptococcus mutans in the mouth. And therefore, if you can dampen down the production of that particular bacteria, you shouldn't experience tooth decay. The systematic review evidence of the trials in this, there's a small effect shown for benefit, but the trials are of particularly low quality. And so it does remain questionable whether you can rely on that. There may be a different mechanism at work by which the act of chewing gum might be quite good, and that you do increase your salivary flow into your mouth, which also can be a buffer of the acids in the mouth as well too. I mean, your saliva is really important. That's how our teeth get nourished as well too, with the saliva. So maybe it's the mechanisms by which you benefit from chewing sugar-free gum may be to do with increased salivary flow into the mouth, because we do know that there are certain conditions which are characterized by a lack of saliva production or a lack of salivary flow into the mouth, which are also implicated in tooth decay. And we also know that there are some behaviors like mouth breathing, and which often happens, and we do see tooth decay presenting quite a lot in adolescent endurance athletes. So while they're doing all sorts of other things that are associated with health, the teeth can be in quite a state. Sometimes that might be something you've observed, Stephen.
Yeah, absolutely. With the consumption of sometimes acidic sports drinks, that can
Mm,
be a big factor too. The there's definitely, you're painting a very multifactorial picture uh,
mm,
for dental disease, which it absolutely is, and it's never the same thing for every patient. And
no,
but it's so interesting to follow, what how we've come to the perceptions of what we see as healthy eating for the mouth, because the problem you described for dentists was a very considerable one. Is that the evidence showed that dairy, cheese, and so forth were protective foods, and that became a big issue as dairy and full fat um, uh, you know, foods containing saturated fat were not being recommended in dietary guidelines. And so this was a big conundrum, and I feel this kind of gets to the one of the big problem points as to why we're in such a state that we're in. Let's go back to what did those, because you mentioned the original dietary guidelines that were enacted in the 50s and 60s. What did they let's go through the evolution of them, because it kind of helps us see where we're at in terms of dietary guidelines. But what were those recommendations, and what evidence were they based on?
well, they're based on primarily the idea that saturated fat was bad for you. And a lot of that sprang from the rather famous or notorious 7-country study, which was Ansel Keys' study of the intake of saturated fat and or dietary fats and heart disease. And so there was some, those studies have been summarized beautifully by Nina Tykos in the book The Big Fat Surprise, and also in particular, and that's is recommended reading in this area. But she goes into the fact that there was a very strong personality who was promoting the idea that saturated fat was harmful, and they basically, through a series of events and some backing by the sugar industry, managed to sell the idea to the general populace that sugar was, or that dietary fat was harmful. And of course, it comes with this idea that the more fat you ate, the more that raised your cholesterol, and the more cholesterol you had, you were going to clog your arteries, and then they would eventually close off, and you would die of a heart attack after a long, after experiencing cardiovascular disease. But we know that that evidence was quite flawed. There were problems in the studies, and that the mechanisms by which we would experience heart attacks are actually quite different, and that it's more related to the calcification of arterial plaque and the snapping off, so to speak, of those plaques that can produce an occlusion of the artery and cause death. So we had these competing ideas through the 50s and the 60s Ansel Keys was a proponent of the view that dietary fat was harmful. And then we had other scientists like John Yudkin and Thomas Cleave who said, well, actually, the sugar is the real culprit. And it also, it's implicated in tooth decay, and it's implicated in all these other non-communicable diseases that are related to dietary intake. But of course, unfortunately, the Ansel Keys theory sort of gained prominence and gained acceptance. And then we've got in the 1970s, you've got the desire to subsidize wheat farming and crop farming in the United States, which is how we arrived at a food pyramid, which had grain-based foods at the bottom to be consumed up to 6 times a day, especially for grown children. And that you could have them as breakfasts and snacks, and at lunchtime and at afternoon tea time, and then some carbohydrate and dinner, but to also restrict your fat content, particularly your saturated fat down there. So there's been industry influence, there's been historical perspectives on the food supply and the pressure to actually for governments to maintain an adequate food supply, because an inadequate food supply has been sort of a problem right up until probably the last 100 years, and probably even people 100 years ago couldn't fathom the environment that we have now, where food is available 24 hours a day, anytime, and you don't even need to cook it. You can just wander down to a convenience store and get a packet of something to eat. So there's been those sort of clash of ideas. There's an idea that won out, but it was also influenced heavily by the requirements of the food industry, particularly those of crop farmers in the United States. And so, which is why we got the pyramid that we've got. And as one of those questions that I saw the other day certainly had, was a question about, why are grains at the bottom of the food pyramid, and why the consumption of those is recommended over and above everything else. And so there's some historical perspectives relating to food scarcity and government trade policy, but also some of the science has been corrupted a little bit along the way. It wasn't the intention. I mean, they'd probably be horrified to see the rates of tooth decay and type 2 diabetes that we've got now. But this is what we've got to, and the food industry has corrupted all this a bit and used a lot of money and a lot of powerful advertising. And here we are now.
It's not often discussed in terms of, it kind of gets brushed away a little bit, but the effects of grains and starches in terms of tooth decay. Saw some recent highlight that the consumption of refined carbohydrates or carbohydrates in the diet does increase the rate of decay. That has obviously been very separate to this whole conversation that we're recommending at the base of a dietary pyramid, consumption of 6 to 9 servings of grain per day. Why, if we're increasing our risk of decay, how is this a healthy recommendation for the entire body? In terms of grains and starches, what have you seen in terms of the evidence in terms of tooth decay?
What we know is through the in vitro studies of plaque or of grain-based products on teeth. There were some really good studies by Keshket et al. In the 1990s, where they looked at the action of the processed starches on the mouth, and they found that sugars were actually retained from those in longer periods of time. So they had these teeth and studied them with these enamel, with these blocks. And they looked at the rate of sugar retention in the mouth over time. And while, say, people could have a really sweet food like salted caramels, and the sugar level was really high, but they managed to clear that sugar out of the mouth really quickly. But starch, starch finished up having a co-karyogenic effect with the other sugars, that actually the amount of sugars sort of went up more gradually in the mouth, but they also stayed in the mouth longer, which has an implication if you're frequently eating these things. Like, say you have a muesli bar mid-morning, so 10 o'clock as it is in New Zealand now, a couple of hours after your breakfast, your mouth is just being continually bombarded with sugar. And so, but that's really interesting, the effect of the starch on those other sugars. And it all breaks down to sugar anyway. So, so in all these foods that are advocated as being healthy, whether it's in muesli bars or these low-fat, high-sugar foods that we're encouraged to have as snacks. And in that review article that we wrote for the New Zealand Medical Journal, we've actually outlined some examples that, okay, here are some foods that the dietary guidelines actually, have, like wheat biscuits. And so if those are staying in your mouth, that's just an extra amount of time that your teeth have been, have a sugar load on them. And then of course they break down very fast. They don't require much chewing as well too. And they go down. And actually where we see that play out is in the mouths of children, very, very young children who have tooth decay because of a high sugar exposure. Well, often they can't actually chew their meals at dinner time because their teeth hurt too much, but they don't have the language skills to communicate that this is a problem. And so what happens is they become graze feeders, and that they sort of do pantry raids and they'll eat crackers and things like that. And so there's continual exposure to sugar like that. But and so which is often why we get this really rampant caries in very young children, where they're requiring the extraction of multiple teeth under general anaesthetic because of that continual grazing feeding that promotes the increase in tooth decay like that. But there's also we know that these ultra-processed foods, and some of the research by John Leonora that you've probably come across, which looks at the effect of the high sucrose diet or a high carb diet on secretion from the parotid gland of parotid hormone, which actually is responsible for that centrifugal cleansing of teeth, which is really interesting because that also, because of the increased metabolism of the mitochondria in the hypothalamus, what that does is it drives increases in insulin production, which brings on hyperinsulinemia, but also it provokes a turning off of that parotid hormone stimulation of that fluid flow that nourishes the teeth. And so whether it's high sucrose or high sugar diet is also implicated in tooth decay through that mechanism as well too, where we've got these malnourished teeth which are then getting an acid attack from outside by what we're eating. And so it's almost a dual process model of tooth decay that we're looking at, isn't it? Where we've got the malnutrition systemically affecting the teeth, but also we've got the acid attack from outside when we're actually eating something. So it's almost like whereas most promotion around dental health is all to do with, reducing the acid in your mouth and cleaning your teeth and using oral hygiene, but there's also something going on internally which affects the nourishment of the teeth as well too.
If you look at the history of dental caries, right back even to Greek times, as to what the theories of what dental caries is, it flip-flops between factors inside the tooth and outside the tooth. And if you
definitely.
Yeah, and dentists were quite ahead of their time to talk about the microbiology of decay and this infective process, but it did become this idea that it was infection. But subsequently, we've been very focused on the outside factors, and you've brought up a really great point there, that there's an endocrine contribution from the body and the brain that is managing how the protective factors for tooth enamel, which is salivary enzymes, and that are excreted from the parotid gland and parotid hormone as well, which is a really big factor, which is then the evidence is starting to show us that we can influence this with our diet. And so the discussion of tooth decay really has focused on the outside factors, but it really starts to blend what we're seeing with consumption of, sugars, refined grains, and metabolic disease, as to how this is, like you say, this double prong. It's fascinating.
It is, and especially when we look at all the research around vitamin D and dental health, and we know that the children of mothers who are vitamin D deficient have an increased risk of developing dental caries as small children, which is really interesting, because then there's real need to then start looking at antenatal health, and you sort of think, well, that should be part of a antenatal screen, is vitamin D intake, given those sorts of risk factors for children's oral health, because we know that the odontoblasts that are involved in dentin formation, the ameloblasts involved in enamel formation before children are born, are also receptors for vitamin D as well too. So the vitamin D deficiency is probably a huge issue, and of course that's very much in the news at the moment because of its role. And we know there's some really interesting studies coming out about the role of vitamin D and its protective effect from becoming very, very ill with COVID-19. So sort of in amongst all this, you're still thinking, well, look, it would be really good if we had more investment in getting healthy anyway. And actually, looking at a diet that actually does emphasize the intake of these foods that have immunological benefits as well too, such as vitamin D. But there's definitely a gap in that prescription of vitamin D rich products and for children, which are your meat and your eggs and your organ meats, and when you learn how to cook them nicely, and there's various ways around that. But it's just really important, as far as, if we just came and ate those sorts of foods and tried to decrease the ultra processed foods out of our diet, then we'd be doing a lot better. But the systemic element, and it's actually when I read your book and looked at vitamin K2 and then sort of did some more reading and more searching around that, it sort of has actually led me to that. So thank you very much for all that. And I'm sure all the readers of that book are probably nodding away in agreement. But it's actually really important to realize that actually the oral health and general health is really tightly intertwined, but the separation of that is a fascinating story in itself, but it's something that does need to be recognized more, that actually if you do an intervention that even should benefit oral health, particularly a dietary intervention, we're probably going to see some benefits for general health as well too, because our heads are not detached from our bodies. And the gastrointestinal system does start in the mouth and, goes all the way through to the other end. But the mouth has been sort of treated as being completely separate from the body, and that's not been a good thing. And yeah.
Well, it was, as I was writing the book, it took me a long time, and I was just so so troubled with how disconnected everything was. And a conversation like we're having today really was, Weston Price was talking about this stuff 70 80 years ago, but
90 years ago.
yeah, exactly. Jumping up and down about it. But we really have not had the time to kind of step back and think, hang on, all these things we're seeing in the mouth is the canary in the coal mine. Do we have the pieces of the puzzle to try and understand this from a complete picture? And it is all there. It's just very disconnected, as you
It's all
described.
there, and it's actually trying to pull that together as well too. And there are plenty of people that recognize that periodontal disease is one of those other big, massive side effects, or as a consequence of type 2 diabetes. But you get lots of researchers who say, well, does heart disease cause periodontal disease, or is a periodontal disease causing the heart disease? And you sort of think, actually, it's probably the diet causing all of these things. And that, someone might have non-alcoholic fatty liver disease, which they might develop before they develop type 2 diabetes. And then there's all these other knock-on effects, like the problems with kidney function, retinopathies, poor wound healing, the disseminated atherosclerosis, but also periodontal disease and the inflammation associated with that, which is a cause of tooth loss, which of course then makes things worse, because then it's more difficult to chew, of course, chew for the foods that you probably need to be chewing, to possibly put diabetes into remission and to reverse those symptoms of type 2 diabetes, which can be done. but the recognition that periodontal disease is very tightly linked to diabetes. That there are some dentists talking about it, but it's not part of the general conversation. It's certainly not reflected in any dietary guidelines for how we feed older people or how we feed people in hospital as well too.
Absolutely, and the health outcomes of elderly people with severe periodontal disease, it becomes a very tragic picture where feeding becomes difficult, and it's such a tragic, as someone that treats it day in day out, it really is a tragic condition where the body is had chronic inflammation throughout its life
Mm.
and is expelling these teeth, and it sounds quite you know brutal in a way, but when we when we lose the ability to eat like this, it's the same thing that caused it in the first place. So
Yeah.
it's just such a difficult problem that if we just start to pin down and think about what is the root cause, it starts to bring us back to how we can solve it, because once it happens, it's a very difficult problem to solve.
Oh, absolutely. And that's all the behavior element as well too, and the sugar addiction as well too. And I've been involved for the last 18 months with a local group that's focused on the reversal of diabetes in particular. And it's really interesting once these people, most of our group members stop eating sugar and reduce the intake of processed foods, well, there's a whole lot of problems that actually just go away. Whether it's the food addiction issues, people discuss not being hungry, and so therefore they don't need to eat 6 times a day, and there's people go into intermittent fasting. But there's a whole lot of issues that resolve very quickly, and the earliest one is probably joint pain. And that's really interesting because suddenly you've got these people who are not addicted to sugar anymore because they've sort of got through that initial part. That might take a week, a couple of weeks. And so suddenly they feel like being more active because the joints aren't hurting. The gout seems to disappear, but the reduction in inflammation. And then people say, and guess what? There's just their teeth feel better. And that's really, really interesting as well, too. And because, they're not having to scrape plaque off their teeth, and they report going to see a hygienist, and the hygienist says, well, you haven't been here for a while, but your teeth are looking really good despite that. And so it's actually really interesting that, we've got this common dietary cause of poor oral health and poor general health. But then once you actually stop doing that, there's a whole lot of other problems that do spontaneously resolve. And, we've seen a number of people be able to reduce their medication use, for instance, and they're just feeling a lot better and they're able to participate more actively in their lives. And that's really quite something to observe, particularly when people were coming up to retirement age when they come to this group and become members of this group. And actually the retirements, those years are looking better than they ever thought they were going to. And these are people who'd had diabetes for a long time, which is fantastic, really. It's like, if we were to hit this bone in your wrist with a hammer over a various amount of time, which is essentially what we're doing to each other with a high carb diet, and then just say, well, stop hitting yourself with that hammer. Your bone might be all right for a start, but then it's going to get very inflamed and a bit red and a bit sore and then quite bruised. And that's essentially what we're doing to ourselves with a high frequency intake of a high carbohydrate diet. And then you stop doing that, and then you introduce other foods in greater proportions into your diet, and suddenly that problem's gone. You've stopped hammering your wrist, it gets better. And then people can increase and improve the quality of life just by eating the right foods. But it is amazing how you can reduce inflammation very quickly in the piece by doing that. And that's probably been one of the more remarkable things I've seen ever, really, in the area of health.
Well, that was one strategy that I employed. After I read Nutrition and Physical
Oh, yeah.
Degeneration, looking at guidelines and what I was taught in, I'm a biomed background. I was thinking, look, I've got to try this, and I didn't have any significant health problems, but the joint pain was something that I was experiencing, and wound healing was quite. I was noticing was quite slow, and I noticed that probably within 6 to 8 weeks of reducing my hidden sugar consumption, that joint pain and things like wound healing began to resolve a lot faster than they did previously. That was something that I noticed immediately.
Yeah.
And there are a lot of anecdotal, kind of stories of this. But it's interesting between periodontal disease and risk of metabolic syndrome, and the two play that they have. We see this clinically a lot. The
Mm.
type 2 diabetics have quite severe periodontal disease. The This disconnect that we're talking about with dietary guidelines and oral health, there is, how would you describe literature to explain how the consumption of refined carbohydrates, beyond sugar as well, contribute to metabolic disease? Because whilst it's quite well known, it's still something that I feel is quite a bit of causes a bit of confusion out there.
Yeah, there's actually not a lot of published studies on sugar and starch and dental caries. Like, we know you still can look at sugar, or you could look at starch, and there's a lot of in vitro studies, but there's very few. Well, there's actually a paucity of research in this area, and that might say as much about the difficulty in actually getting these things published as much as anything in these journals, because they're not findings that are particularly amenable to messages that are promoted in dietary guidelines. But and so that's quite interesting, but it's actually a case of pulling all this together. And there's some more research coming out now on the role of ultra-processed foods, because you're probably aware of the NOVA guidelines that are used in Brazil now, where they're a set of food-based guidelines that classify foods according to the level of processing. And so there's a range of studies that were published in 2018 and 2019 based on these classifications of foods. And so what we do know is that those foods classified by NOVA as ultra processed, which means they have a minimum of 5 ingredients, and there's plenty of emulsifiers, fat, sugar, salts, oils, and other items that are listed as numbers on the ingredients. So it's essentially all that stuff in supermarkets that you might not be able to pronounce the ingredient list of. All those sorts of foods have been found to be associated with increased risk of cancer and neurological problems and cardiovascular disease and type 2 diabetes. But there's no review out there that looks at ultra-processed foods on this definition and dental caries. And so that's actually really interesting, and that's where we're trying to make some inroads there, is actually raising the awareness that these ultra-processed foods are associated with dental caries alongside all of these other conditions as well too. So I think if we can go into research that's based on foods as opposed to macronutrient content, because at the end of the day, the consumer, we'll go to the supermarket and we don't just have a list that says, well, today I'm going to have X amount we're going to buy some protein, I'm going to buy some fat, I'm going to buy some carbohydrates and buy some vitamins. We actually will go with a shopping list of foods. And so if we can actually come up with recommendations around food-based guidelines that are actually easier to interpret for the consumer, that get rid of all this health star rating, where we sort of actually look at, okay, to what degree are these items processed or not? And, the levels of processing, that's probably going to represent a better way forward, because there is general agreement that, and, often it's nice to come from a place of agreement. There's general agreement that it's the ultra-processed foods that are associated with harm through a range of mechanisms, whether it's a displacement of vitamin and mineral-rich foods from the diet, but also the effect of all the sugar in them on us as well too. Yeah. So there's not a lot of research in that whole sugar and starch thing, because, starches that you consume as, say, a potato or a carrot is quite different to starches in a muesli bar that has a lot of added sugars and emulsifiers as well too. Yeah.
And your papers discussed because tooth decay and obesity really does, it's one of the big topics throughout society that is that is connected to diet. So I mean, in terms of obesity now, where are we at with scientific literature and what we understand of carbohydrate consumption?
Well, what we understand that, the very high and frequent intake of sugars is, very strongly associated with obesity. And, a lot of the research around obesity prevention, dietary intervention is recommended for obesity. But What we do know is that your full-fat dairy is, there are inverse associations with the intake of full-fat dairy and obesity as well too, which is really interesting because our dietary guidelines recommend that to, consume low-fat versions of dairy produce and meat to prevent becoming obese, but the evidence suggests associations the other way around. Definitely. Yeah, so that's a huge disconnect as well too. So not only is full fat dairy beneficial for oral health, but it's also associated with leaner, lower BMI, better waist to hip ratios, which are another way of measuring anthropometric outcomes as well too. So we do know that the intake of full fat dairy as part of a whole foods based diet is beneficial over and above low fat dairy, which is really interesting too.
It goes back to the problem point of dentists, knowing that, seeing and being taught that the literature that dairy protects against tooth decay, but then this whole conversation that fat is bad for us. So it's a very hard problem. Sarah, where would you like, how would you see, as someone that's looking at this from a public health perspective, where would you like, or where do you think this conversation needs to go in terms of where the guidelines need to be tweaked, and what do we need to do to start to overturn this problem of both dental caries in both younger and older generations, but also obesity and type 2 diabetes in the future?
How long have we got? I think we need, it's a multi-level beast to tackle, Stephen. We do need an overhaul of dietary guidelines to make them more food-based dietary guidelines for the ease of the consumer having to interpret this evidence, but also for the health promotion strategies that are underpinned by dietary guideline advice, whether that occurs for the advice that we give people who are expecting children, right through to what foods we allow at schools, what food we allow at public facilities, including your hospitals, schools, all the way through the life course. We definitely need a change in the dietary guidelines, for instance, and to move away from a focus on just fat or carbohydrate, but actually looking at the processing of foods in line with the evidence, especially around the intakes of full-fat dairy and vitamin D rich foods, particularly given the protective associations for whether it's oral health, whether it's general health, but oral health and general health should be regarded as just completely integrated as opposed to being completely separate. That's really important. We also need, so because the dietary guideline advice, because of the underpinning of those sorts of, health promotion advice, that needs to change. We also need top-down change. It would be lovely to be able to think this is an easy fix, but we need governments to actually step in, and that is going to involve elements around the marketing of these foods associated with harm, what we allow advertised to our children through broadcast and digital media as well too. We had a situation in New Zealand where during the level 4 lockdown that we had over here, that you could have these isolation games, and this was broadcast at 7 p.m. and the prize there for sending in your video of what you got up to with your family were Pizza Hut vouchers. So that's a problem as well too. So we need all our advertising standards authorities to be able to create some more structure around what we do promote. And so we do need changes in the food environment. That's an absolutely imperative to actually go forward from here, because that's a barrier to people eating well, even though people know what they should be eating for their general health, low sugar diet and whole foods. The food environment and our lifestyles, are implicated in that. So we do need some changes from there too. And we do need changes even in the education of our healthcare professionals around diet and nutrition. Now, for instance, doctors are allowed to prescribe dietary interventions for therapeutic purposes, but they have so little training through the medical school system that they don't feel, a lot of them then don't feel qualified to provide dietary advice as well too. So there's a range of changes that we need to see and some research around that, because there's disconnects between obviously health professional knowledge as far as dietary interventions go on the basis of what they've been trained and the evidence. So So there's a number of changes, but we do need to, the dietary guidelines are obvious, I think, starting point, but we also need to tackle the food environment at all levels, whether it's nationally based at community levels, but we also need a lot of civil society engagement, because a lot of the changes are not coming from the top down, because there's a lot of scientists who have been promoting a point of view for a long period of time, and it's in their best interest to do that, and it's really hard to turn around and admit that you're wrong if you've been doing that for 30 to 40 years. Since the establishment of dietary guidelines. So I think we ultimately, and for everyone out there, we just need change to happen at a grassroots level. And civil society does have to become engaged, because what happens is governments will possibly be making decisions on the basis of election cycles as well too. And there's a perception that, we might not be able to achieve these sorts of changes within a 3-year cycle, but there are changes we can make, and it does require the engagement of all of us, and with what we know that's implicated in poor health, but what we also know about the foods that we can eat for better health as well.
Certainly, in thinking about how to change something like guidelines, it is definitely a big problem where government cycles,
Yeah.
and these these problems aren't going to untie in one election cycle. So that it's certainly
No.
it's a big consideration that that a lot of this will go onto the communities, and that we have to
Yeah.
take our responsibility for what goes into our body, and that everyone
Yeah.
should be doing their own research, and that we have to push forward with the good work that your people like yourself are doing, like to lay out all of the evidence and look at the historical perspective of food, and what food does for our health and our ancestors, and then also in a modern context of how it relates to risk of disease too. So all these things need to come together. Very big problem,
Yeah.
but ultimately comes back to the the onus is on the individual.
Yeah, it is. It is on individuals, but I think the exercise in doing this thesis, we're all the captains of our own ships, aren't we? And we're the president of our own lives and all the rest of it. But we've been told for years that what you do and your health status is predicated on cleaning your teeth, exercising, and doing all these things. And so there's but we've got an environment and lifestyle where we're working these long hours, and we're pressed for time, and we've sort of lost the art, and we've also lost the art because of a number of social changes that happened, of how to prepare food well, which includes how we prepare fermented foods and all those sorts of things. So there's a whole lot of other stuff that's gone out the window a little bit more in the last 30 to 40 years than, say, when yours and my grandparents were growing up, and they got to eat whole fresh foods because that was all that was available. We didn't have this food environment, and we didn't have all the advertising and all these other factors that impact on our food choices. But so it is a multi-level approach that we just really need to start tackling, and we need to tackle it now, because the general health of the general population isn't improving, and that there's a huge gap between our healthy lifespan and our real lifespan, where actually many of us are finishing those last few years of our lives with chronic illness and in pain. Then we're dependent on other people for an average of 4 years before we actually die. Whereas also we'd actually ideally like to be going gangbusters right up until the last day.
And no reason why we can't.
And there is no reason why we can't. And people have been doing this over time for many, many years. And actually, one memory that does sort of strike me is we were in Norway years ago, and we were visiting a UNESCO World Heritage Site. It was one of those beautiful wooden churches. And so we were waiting for the bus to take us back into town. And so we were just wandering around the cemetery just to see what happened to people. And apart from women who died in childbirth and men who went missing in fishing accidents, everyone lived to a really ripe old age with running around the hills. And, this was on the hills of Norway. It's really hard to grow grains or anything there because it rained 330 days in a year. So, these environments were not exactly set up for lovely vegetable gardens and, the production of foods, but they lived very, very well off fish or whatever beast happened to be wandering around at the time. And I think there's a lesson in that for all of us that basically everyone lived to 80, 90. There are a few centenarians there as well too. So there's some lessons in that too, and that we lived quite well. But that gap between these days, our healthy life expectancy and our actual life expectancy, is getting bigger, and it's actually really tough if you're a Maori or Pacific Islander. In New Zealand as well too, due to a range of reasons. Their healthy life expectancy for a Maori man, I think, is only about 54 years. And that's really sad.
Yeah, and we are seeing these trends around the world where
Yeah.
Indigenous populations are suffering more from these chronic diseases. As it's the same thing that Price, observed, as you said, 90 years ago, that in one generation, once we eat the modern diet, we become the sick and kind of debilitated population that we are today. But there are ways out of it. The evidence is there, as you put out so well. And actually, I'd like to add, with in Norway, they have the excellent extraction processes of pure cod liver oil there, so that might have been a contributor.
Yeah, but I think there's also but it's a fish-based diet, isn't it? That they had the fish, and they ate liberally from the sea. They were really good hunter-gatherers, but I mean, it was so cold and wet there, they'd have to be. And but they did live for a long time, and it was just, I saw that in about 2002 we were there, and it sort of was something that stayed with me at the time. And it's an interesting anecdote to pull back, but it's just a case of pulling all the evidence together for oral and general health, and just sort of putting that together. And actually, but it's an uphill battle, but it's a battle worth fighting.
It's definitely a battle worth fighting. Well, Sarah, thank you so much for joining us today and sharing your knowledge. We'll be looking forward to for reading your PhD. For anyone interested, if you want to let them know anything that where they can find you, or what you're working on that's coming out.
Work at the moment, I've submitted journal articles to various, articles to various journals that are the chapters of my thesis. But if you want to contact me with any questions, anything like that, you're more than welcome to do so. And my Twitter account is sjhancocknz. And I can pop that in the comments on this post after we finish talking. But it's been an absolute pleasure talking to you and about all this research and the evidence, and how we've got to where we've got to, and where we can go from here, and why we're in the position we are now. It's been really nice to be able to discuss this. So thank you very much for having me on your podcast.
Well, Sarah, it's my pleasure, and thank you for all the work that you'll be doing to further this conversation. And I hope that this isn't the last conversation we have in this area. And I'm hoping not. I'm hoping it's more developed as we, by the next time we talk. So, thank you very much again, and I hope you have a great day. And
you too, Stephen.
And looking forward to your PhD. Bye, Sarah.
Okay, Stephen. Hey, it's been great talking to you. Bye for now.